Hello, I'm Dr. Cynthia Gregg at Cynthia Gregg Face and Body Specialist, and welcome to my presentation today on rejuvenation of the lower face. But before we start talking about the treatment options and ways to rejuvenate the lower face, let's first talk about the aging process that affects the lower face. Many of us like to think of aging as a deflation of a beach ball. So in our 20s, we have this round, full beach ball, and every decade we slowly leak air and we slowly deflate. There is some truth to that. But I think the split screen here of this mother and daughter is a better representation of what really happens with aging. Yes, there's deflation, but there's also descent of the tissues. The other point that this slide points out is that there's a strong genetic background that affects our aging process. We have a genetic predisposition to how we're going to age. Now, we do have some control of the aging process. We have control over our smoking history, we have control over the amount of sun exposure, and we have some control over the stress in our lives. And these are the other factors that can accelerate our genetic predisposition to aging. This is another split screen of a young, youthful face and a more mature face. And it emphasizes that starting at age 30, we start losing about 1% of collagen, so our skin starts to thin and lose elasticity. There's also laxity of the muscles and the soft tissue. Starting in our 40s, our 50s, and 60s, we start losing volume. We start losing volume in our fat tissue, we start losing volume in our muscles, and we actually start losing volume in our facial bones. And this is emphasized here on the more mature side with this acceleration of this tear trough deformity across the cheek, a deepening of the nasolabial crease here between the nose and the corner of the mouth, loss of bone on either side of the chin, loss of bone in the mandible, and the widening of the orbital bone creates the look that we have as we age in the lower face. So what options do we have to combat this process? Well, a surgical option is a facelift. Well, what is a facelift? Surgeons refer to a facelift as a rhytidectomy, but it's more commonly referred to as a facelift. But the name facelift would imply that we're doing something surgically from the hairline down to the neck, and that's not true. Classically, a facelift includes an S-lift or jowl lift, which improves this area here along the jawline, and a neck lift, which improves the jawline down to the inferior neck. I also include a procedure called a mid-face lift, which is also a cheek lift. What type of incisions can we use when we perform a facelift? Well, as surgeons, we have options, and we really dictate our incisions by the facial anatomy. But this is an example of a patient of mine and a kind of a classic facelift incision. For the S-lift or the jowl lift, the incision starts up here in the hair by the blue line, comes around the front of the ear. These dots represent that it goes behind the tragal cartilage, around the earlobe, on the back of the ear skin, and then way up high it goes back into the hair. And it's important to note that because you don't want an incision down low, particularly if you like to wear ponytails. This blue arrow here is to remind me that we also have a very small incision underneath the chin if we need to do any anterior neck work. The mid-face part of a facelift for me, I have to add an incision. I add an incision way up here in the temple and also one underneath the upper lip. Why do I think it's important to add the mid-facelift to a lower facelift? Because if you look at the vectors of pull, it's important to get a natural look, to lift the tissues back from where they came from. So the classic facelift incision here, the vector of pull along the jawline goes right in front of the ear. The vector of pull for the neck is to go right up behind the neck. But it's not appropriate to have this apple of your cheek pulled here to the ear. It needs to go up. Thus, I add a mid-facelift because I think it gives a more youthful, rested, natural appearance to a lower facelift. Now, a mid-facelift can be performed by itself. Here's an example of the youthful face with the malar cheek pad, apple of your cheek sitting up high on your cheekbone, and as it descends and deflates, it gives us a very flat cheek. And I use a device called an endotine. It's a dissolvable suture device that helps lift the soft tissues up in a superior posterior vector through that temple incision. It can also be combined with other procedures. Here's a patient of mine. She was 46 pre-op, 2 years later at 48. You can tell she had eyelid surgery done, but she's got still a nice round mid-face as a result of performing the mid-face or cheek lift. Here's another patient of mine, 58-year-old female, who decided that her mid-face was very flat. She didn't like the appearance of her mid-face. Her jawline was fine, but she had 2 bands in her anterior neck. So she had the mid-face, did not have the jowl lift, but had the neck lift. Now here's a patient who's 58 years old who decided that really what concerned her the most was this jowling here along the jawline. She had a nice cheek, beautiful bone structure, nice anterior neck appearance. So she had just the S-lift or jowl lift incision around the front of the ear, and here she is 4 months post-operatively. Now the neck lift has several parts to it. The platysmaplasty is the part that deals with the muscle bands. There's also some fat removal, liposuction or lipectomy, and there's removal of excess skin. This diagram here on the left is important because it shows you that the causes of the appearance of the neck could be just due to skin laxity, it can be just due to excess soft tissue, it could be the banding of the platysma, it could be a combination of those three. It could also be accelerated by the fact that just congenitally you have a very small recessed chin and a very low hyoid bone. And it's important during the consultation that I point these out to you so you have a clear expectation of what your postoperative results will be. This diagram here shows you what the platysma muscle looks like. We have a left and a right muscle. They don't meet in the middle. So as we get older and these bands relax, it looks like an upside down V hanging underneath our chin. A large part of the procedure for me is to do what's called a platysmaplasty, represented by these red arrows. I'm actually pulling those bands together, and then I'm also pulling them back by the black arrows to create kind of a hammock or a sling effect to the anterior neck. Here's an example of a patient who was in her late 50s, who had a very full cheek and lovely jawline, but really did not like this excess tissue in her anterior neck. So here she is 4 months post-op after undergoing only a neck lift. Here's a 55-year-old female who had all 3 parts. She had what I would consider a facelift, mid-face lift, a jowl lift, and a neck lift. And you can see on this oblique view this lovely improvement in the mid-face. Her jawline is very well defined, and this lateral view really shows you the nice anterior neck angle. The other thing that you can do with a facelift is we often will combine it with laser resurfacing to address the wrinkles around the mouth. Here's a 45-year-old who also went through the mid-face, jowl lift, and the neck lift, what I refer to as a facelift. And here she is with a lovely result 4 months after surgery. You can tell nice improvement in the mid-face, jawline, definition, and her anterior neck appearance is nicer. You also have some non-surgical options, though, for rejuvenation of the lower face. Ultherapy is one. Ultherapy uses microfocus ultrasound waves. We have this option in our office. And here are 4 patients that are 90 to 180 days after having Ultherapy, and it shows those very nice improvement in the appearance of the lower face and neck. This is an option for patients who may have had a facelift years ago and they want to do a non-surgical tightening. This is also an option for patients that are younger and they're not quite ready for surgery or they're not a surgical candidate. Another non-surgical option is Kybella. Kybella has been FDA approved to remove, completely dissolve the excess fat cells underneath the chin. This is a patient of ours after undergoing Kybella injections to the submental area to remove the excess soft tissue. You do need to have a certain amount of elasticity of the skin, though, for this to give you a nice result. I know we talked about how the platysmal bands can be a result of aging, but they can also be hyperdynamic or overactive and have tension in them, as shown in this picture here on the side. So these black dots will show you the areas that we can treat with a neuromodulator, such as Botox or Dypsort or Xeomin, to help relax a hyperdynamic or overactive platysmal band to give you a nicer appearance to your neck. So in closing, we've talked about several non-surgical options. We've briefly touched on Ultherapy, Kybella, and the Neuromodulators. We also briefly talked about laser resurfacing, there's skin care, there's chemical peels, there's microneedling. All of these are options to rejuvenate the lower face. I also want to mention that fillers are a phenomenal way to improve the volume loss that occurs in the upper and lower face. We've talked about the surgical options, a facelift, which to me consists of a mid-face, a jowl or S lift, and a neck lift, and how you can have those individually or combine them in 2 or 3 sections to get the result you want. So it's important during the consultation that you share with me what concerns you the most. We look in a mirror together and talk about what concerns you the most. And then my job is really educate you to this wide range of options you've got. And I want to make sure that we choose the path for you that's going to give you a youthful, rested, but a more natural looking result. Thank you so much for attending my presentation today. I really appreciate it. If you have any questions about this, please email me today at surgeryquestions@cynthiagreggmd.com, and I will get back to you today as soon as I can. Again, thank you so much, and I look forward to seeing you either in person or virtually for a consultation. Thank you.